الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. دكتورة كلثم جبر الكواري, Assistant Professor Social Science Department, Qatar University. Today I will talk about lesson of an advanced response to treatment and the Qatari society, a spiritual approach, perspective, and the clinical social work in Qatar. Qatar is paying a lot of attention to providing an integrated core program for combating drug abuse. This exemplified in the national strategy for drugs in Qatar 2010 until 2015, along with the Qatari vision in 2030. This strategy, Qatar, very interesting for protect the person from youth about this strategy. And last year, many of the Qatari youth use drugs, and they, from shame and stigma, they not need any help. Some of them die. For that, government moving for protect this youth from Qatari. And this study is old. The process for this research is still not complete because I used an old data on in the presentation. I will present you today at the data on this presentation applied at the Treatment and Rehabilitation Center at Doha. Now, we have the treatment center in Qatar called Nobar. Nobar, which is high quality on the international center. I must update my data in this center, but in the reason of my data and because the center was not formally opened. For that, I not work with them still. The Nova have high quality for teamwork there from different countries, from United States, from Australia, from Lebanon, from England, but still not, the process, they not accept for me for take any patient there because still not open. Qatar has taken steps to provide care to slay drug abuse, To this end, multiple steps have been developed at national strategy for stopping drug abuse in the state of Qatar 2010-2015, National Vision of Qatar 2030, conclusion research by Protection, Treatment and Rehabilitation Center. Question: what the induction for addict response to the treatment? What are cases of an addict response to the treatment? What is the program to reduce an addict's response to the treatment? Sample subject of the study. The present study was applied to internal units of a treatment center and rehabilitation in Doha, housing 28 male Qatari adults, nationality Qatari adult addicted on any drugs, any kind of drugs, who were diagnosed as drug addicted, along with members of different professions of occupations, 15 workers. The skills, these are prepared by the researcher as following skills: reason behind the addict's response to treatment in the Qatari society. It was administered to the 28 addicts. Second skills for the teamwork, who's working in that center, and about 15 persons. This is part of a novel, but still not opened. Answer to research for question. 1. Results show that the response used by the addict to treatment is the most in the Qatari society compared to the self-response. The imply that response to treatment minority depends, which in the turn hearts in the treatment process. بالعربي المقاومة some of you in the Arab you can speak Arabic. المقاومة الدفاعية، هناك مقاومة دفاعية من قبل المدمن from the person, not from outside. They have clinical and the government the care of them, but they from itself not accepted any kind of the help. The result, the table 6 show an increase in self attributes index compared to environmental cases of resistance to treatment in the Qatari society, reflection that individuals themselves are willing to put resistance to treatment for self 0.73, for environmental 0.68. The answer for second question. The addict results to resistance more than self at the outcome for environmental one, so in other words, defined as to the full recovery from addiction are blamed on the individual consequently. The researcher try to meet of some of them, but because I am my nationality Qatari and all of them Qatari, they refuse meet with me because I still have some culture in GCC or in Arabic, all about shame. Table 10. Also, it's the defense resistance outweighing radio scenario 0.92. This is mean they not have aggressive resistance scored. In other words, the majority of the center's staff that the defensive resistance of the most problem by the addiction to contract treatment in the Qatar society compared aggressive defense. بقرا بالعربي وبالإنجليزي الخلاصة for I am understand also. Conclusion. الباحثة حاولت في هذا البحث تصميم برنامج مقترح لمحاولة التخفيف من مقاومة المدمن للعلاج في المجتمع القطري من منظور المدخل الروحي في الخدمة الاجتماعية الإكلينيكية، لذا عرضت الجانب النظري لوضح أهمية هذا المدخل. The researcher attempts to propose program to the addicts resistance to treatment in the Qatari society using the spiritual, respective and clinical social work. With that in mind, the researcher the theoretical aspect. Moreover, the present study stresses the fact that self for addiction, for environmental cases, program is designed to help alleviate the client's resistance to treatment with better outcome for the therapist program in Qatar society for inshallah المستقبل. This result will lead to design a professional intervention program depends on spiritual religious um, for derived from Islam program or spiritual based reading therapy and CBT, cognitive behavior therapy. Thank you. I am trying to do some abstract about this. But inshallah, in the future, when I am intervention with this patient, I will talk more about experimental study and about the novel. Shukran jazilan. Thank you very much for all.
Thank you. All right, so let's just jump right into our second presenter. Let me set this up.
Okay, what is it there?